It is a controversial drug that was once touted as a cure for COVID, despite no evidence to show it actually worked. Now, prescriptions for Ivermectin are soaring, this time for cancer. Some doctors say the hype is outpacing the science, and many worry about the impact it could have on cancer patients. So why are people trying it? News 4's Erika Gonzalez is working for your health with a closer look at the medical misinformation dominating social media.
Cancer cure or clickbait? That's the question at the center of a controversial treatment that's been getting a lot of attention online. The buzz started after actor Mel Gibson said this on the Joe Rogan Experience podcast.
I have 3 friends. All 3 of them had stage 4 cancer. All 3 of them don't have cancer right now at all.
What did they take?
Jesus. They took what you've heard they've taken.
Ivermectin.
Fenbendazole.
Yeah.
That episode went viral with more than 13 million views on YouTube. And since then, a study published in the Journal of the American Medical Association shows prescriptions for ivermectin have more than doubled among cancer patients. And users on social media are crediting the drug with curing their disease, describing it as a lifesaver.
And I truly don't believe I would still be here if it hadn't been for fenbendazole, ivermectin, and Liz.
But experts we spoke to say not so fast.
There is currently no high-level evidence to support that it actually has any proven benefit in treating cancer in human beings.
Dr. Nitin Verma is an oncologist at Kaiser Permanente and says there is no scientific evidence showing that ivermectin is safe or effective for treating cancer. Ivermectin is FDA approved to treat parasitic infections in humans, and it's a popular dewormer for horses. So where did the claims come from? According to the American Cancer Society, they're based on early studies of ivermectin's effects on animals and on cancer cells in petri dishes in a lab. Researchers at Cedars-Sinai Medical Center are doing a clinical trial evaluating ivermectin combined with immunotherapy for metastatic triple-negative breast cancer. But the study is small and it's still in its early stages. Others, though, aren't waiting for clinical proof. They're giving it a try. And doctors warn using ivermectin off-label for cancer could come with serious consequences, especially if patients put proven treatments like chemotherapy and radiation on hold.
For me, I feel the biggest downside of this is delay in getting the effective cancer treatments. So using alternative medicine can sometimes delay, which can worsen the outcomes when we talk about cancer treatments.
And that's not the only risk.
When they're used in high doses, they can actually cause severe neuropathy or even seizures.
Doctors also worry unproven treatments like ivermectin give patients unrealistic expectations during an already difficult time.
It gives false hope to patients and families when they are already in this vulnerable time during their cancer journey.
So for cancer patients desperate for alternatives, what can they do?
When we get to a point where we don't have any FDA-approved treatments, we certainly look at clinical trials. And when it's done in a clinical trial setting, we are very carefully monitoring side effects of these drugs and actually having a more regimented way of assessing the patient at scheduled intervals to make sure that the drug is working.
And as medical misinformation continues to spread across social media, he says the most important conversation is the one you have with a trusted doctor in an exam room, not strangers in the comments section.
I think it's so important to have an open conversation with patients because we know in this day and age that patients are going on social media. So sometimes my approach is just to ask them online, hey, have you looked at something online?
The National Cancer Institute plans to study ivermectin for the treatment of cancer, but that too is in the early stages. Both the FDA and the American Cancer Society do not recommend ivermectin for treating cancer. Dr. Verma says the bottom line is simple. Before starting any treatment, talk with your oncologist to make sure the evidence is as strong as the claims circulating online.